Bariatric surgery is often framed as a last resort for severe obesity, but growing evidence suggests it may be far more than a weight loss tool. It could be a powerful cancer prevention strategy. For adults with obesity, this kind of surgical intervention has been linked not only to dramatic weight loss and metabolic improvements, but also to a significantly lower risk of developing and dying from obesity-related cancers. Yet despite these promising findings, bariatric surgery remains vastly underutilized, underdiscussed, and, in many ways, misunderstood. Studies have shown that people who undergo bariatric procedures like gastric bypass or sleeve gastrectomy experience up to a 30 to 50% reduction in cancer incidence and mortality compared to similarly obese individuals who do not have surgery. This is not just about shedding pounds, it's about halting a cascade of biological processes that fuel tumor growth. Excess body fat drives up levels of estrogen, insulin, and inflammatory markers, all of which contribute to DNA damage and cellular environments that support cancer proliferation. Bariatric surgery rapidly reverses many of these disruptions. After surgery, estrogen levels drop in postmenopausal women, insulin sensitivity improves, and systemic inflammation decreases, all of which lower the risk for cancers like breast, endometrial, pancreatic, and colorectal. These changes are not cosmetic or superficial. They're biologically profound, altering the body's long-term trajectory away from cancer-friendly conditions. And yet, access to this life-saving intervention is riddled with barriers. First, the stigma surrounding obesity, even in medicine, means that many patients are never offered surgery as a legitimate treatment option. Instead, they're told to try harder with diet and exercise, even when evidence shows that these methods alone often fail to produce sustained weight loss in severe obesity. By the time cancer develops, the opportunity for prevention has long passed. Insurance restrictions also play a major role. Many plans impose strict requirements, like documented failed weight loss attempts or multiple physician visits, before covering bariatric surgery. Others exclude it entirely. This gatekeeping disproportionately affects low-income patients, even though they are among those most at risk for obesity-related cancer and the least likely to afford out-of-pocket surgical costs. Furthermore, the discussion around bariatric surgery is often dominated by cosmetic narratives. Media portrayals frequently focus on appearance changes rather than health outcomes. As a result, many people who could benefit from the surgery do not fully understand its impact on chronic disease risk, particularly cancer. Others are deterred by fear of complications, which are relatively low when procedures are performed in accredited centers, but still exaggerated in public perception. And perhaps most critically, bariatric surgery is rarely incorporated into broader public health strategies. Obesity is treated as a behavioral issue rather than a medical condition with clear biological consequences. As a result, even with compelling data, surgery remains a fringe solution in the eyes of many health systems, policymakers, and insurers. That's a dangerous oversight. As obesity rates climb and obesity-linked cancer surge, especially among younger adults, ignoring or downplaying a proven intervention like bariatric surgery is not just negligent, it's fatal. This is not about promoting surgery as a cure-all. It's about recognizing that for certain high-risk individuals, it is one of the few tools that offers both rapid metabolic correction and long-term cancer protection. We need to reframe the conversation. Bariatric surgery isn't about vanity, it's about survival. And when lives are on the line, especially for those who have been failed by every other system, from food policy to healthcare access, it's time to stop pretending that eat less, move more is an adequate prescription. It's not. In many cases, it's a delay tactic that ends in diagnosis and loss. Until the healthcare system, public health campaigns, and society at large start treating obesity and the cancer it causes with the seriousness it deserves, we will continue to withhold the very interventions that could save the most lives.